Colorectal cancer is the third most commonly diagnosed cancer, the second leading cause of cancer death in both men and women here in the United States. What is most striking, in most cases with early detection, death is completely preventable. March is Colorectal Cancer Awareness Month, and Dr. Brenda Hoffman is here to talk to us about screening and ways that we can prevent this cancer. Thank you so very much. We're talking about the president having his cancer screening today.
We did. I'm so glad to see that he did that because so few Americans actually do what they're supposed to do, which is get their colorectal cancer screening. We're only running rates of around 60%. So our push in March is to make people more aware that colon cancer is a preventable disease. You don't have to die from this type of cancer.
What age should you have your first screening, and what does that involve?
You should have your first screening at age 50 if you do not have a family member with colon cancer or with colon polyps. Of course, if you have symptoms, you should get screened at the time that you have.
Okay, let's talk about symptoms. What are those?
The rectal bleeding would be an indication, abdominal pain, a change in your bowel habits from what is normal for you without something recognizable that you've done, like going on a special diet or such.
A lot of people don't like that old colonoscopy as the screening tool, but it can save your life.
It really can. Some people are embarrassed to have to perform that, and really you don't die of embarrassment, you die of the cancer, so it's much more important to do that. There are other options. I think that that is the best screening test that we have. It allows you to pick up polyps, which are precancerous, so it prevents cancer where other forms don't. And it allows you to take care of those while you're there. So one prep, one procedure to get all of that advantage. But there are other ways to do that. And for example, President Obama chose a different way to get his colon cancer screening. And other options are available, including fecal occult blood testing and other studies for patients.
And the president doesn't talk about this much. He does smoke occasionally, and that increases the risk, does it not? And why is that the case?
It is probably an alteration of your protective factors, where we develop abnormalities that keep us from shedding the cells that we should, and we get changes in our DNA over time according to what we come into contact with. If we drink too much beer, if we smoke cigarettes, if we take too many fats in our diet, all of those are risk factors for colon cancer. So we can make a big difference in our health just by altering those factors.
The numbers in South Carolina not good for African American men in terms of colorectal cancer deaths. So what do we need to do here to make some changes?
We need to make African Americans aware that a recommendation is that they begin screening earlier at age 45 instead of age 50. That we also know that people's diets play a role. We need to get out there in the community and make sure they understand that. We know some factors that may account for that increased death rate, including African American men not particularly wanting to perform those types of screening procedures, so we need to focus on their wife and their children to get them to make dad go get his colon cancer screening.
All right, we need to get everybody out there to get checked because it does save lives. Thank you so very much for being with us. For more information on where you can be screened on our website, head to live5news.com and type in the speed word colorectal cancer.